Today we'll discuss on the hospital-acquired infection or the nosocomial infection. So, an infection acquired in hospital by a patient who was admitted for a reason other than that infection. Suppose a patient is admitted for a particular disease. For example, he is admitted for any road traffic accident or any kind of infection, but he has acquired another infection from either from the hospital staff or the hospital materials which are used in the hospital, instruments or any invasive procedure, or from another patient. If he or she, the patient, has acquired that infection from inside the hospital, that means it is known as the hospital acquired infection. So we can also see here in the second line, an infection occurring in a patient in a hospital or other healthcare facility in whom the infection was not present or incubating at the time of infection. It is known as the hospital acquired infection. So it may be from either the healthcare facility or an infection which is present or incubating at the time of infection. The signs and symptoms may not be there, but the virus may be present inside the body. This includes infections acquired in the hospital but appearing after discharge, and also occupational infection among the staff or facility. So these infections might be in between when the patient is admitted, at the time of admission, or at the time when the patient stays in the hospital, or either after the discharge. So this hospital acquired infection, it is not only for the patients, it can also occur among the staff members. So the infection or the injury which occur at the occupational site, that is the place of working, is known as the. So if the staff or any healthcare members which are present inside the hospital, which are involved in the care system, they are also infected with any kind of infection, that means it is also known as the hospital acquired infection. Hospital acquired infection is also known as the hospital associated infections, hospital infection, or the nosocomial infection. Then causes of hospital acquired infection. There are many causes. The first one is due to any invasive procedures. Invasive procedures, like these are the sterile procedures or the invasive procedures. They include the surgical operations. If the patient has undergone any type of surgery or operations, he or she might be at risk of developing an infection. Then intravenous therapy, it includes the cannulation or any injection which is given to the patient through the intravenous route. Intubation, that means it is a tube which is used to provide the airway to the patient. So while doing this procedure also, the patient might acquire any infection. Then catheterization, so this is also inserting an indwelling catheter is also a sterile technique. So if the patient is undergoing any catheterization procedure inside the hospital, then he or she is at risk of developing another through this procedure. Then next is the immunodeficiency. Immunodeficiency means the person's immune system is very low. These are patients at extreme of age, so either old age or either newborn, or any children which is under the 5 years, or any adults which are above the 65 years of age. They are very prone to developing the infections. Their immune system is low. Then patients with diabetic patients are also, their immune system is also low, so they are at risk of developing the infection. Then patients who are receiving the immunosuppressive drugs, and patients with cancer who are undergoing the therapy. So in all these patients, they have the low immune system, so they are at risk of developing this infection. Sources of infection in the hospital. There are two main sources: exogenous source and endogenous source. Exogenous source means from another patient or staff member or the environment, and endogenous source means from the patient's own flora or patient's own inside the patient's body. Exogenous source examples of exogenous source include from the other patients, that is cross infection. Then from the healthcare workers, from the inanimate objects like fomites or vehicles. So any type of instrument or any type of material that the patient might get in touch or might use to the patient, they may carry the bacteria or virus. So due to the because infections may be occurred in an inanimate environment of the hospital, like contaminated air, water, food, contaminated instrument, equipment, sweat, linen, hospital waste, or the biomedical waste. So inanimate environment, that means the infection causing organisms might be present in the air or the water the patient is taking, or the food the patient is taking, and from any contaminated instrument that we use to the patient, and equipments and soiled linens, from the linen also from the hospital, clothes, bed sheets, blankets, and all, they may also be transmitted, and hospital waste. That is the next is the endogenous source. That is the patient's own flora. This patient's own flora may invade the patient's tissues during some surgical operation or instrumental manipulations. The normal commensals of the skin, respiratory tract, GI tract. So here, from the inside the patient's own flora, after they undergo any surgical treatment or any surgical procedure, inside the patient flora there are some organisms which are living inside our body. So this may attack our own body, inside our body. So due to that, infection might occur. So this is known as the endogenous source. Then next we'll see the various microorganisms. So these are the pathogens that are able to survive in the hospital environment and develop resistance to antibiotics and disinfectants. So there are many disease-causing organisms which may be transferred from one patient to another. These are the bacteria, virus, fungi, protozoa. So bacteria, under the bacteria we have the gram-positive bacteria and gram-negative bacteria. Examples of the gram-positive bacteria we can see, for example, the Staphylococcus aureus, Staphylococcus epidermis, Streptococcus hemolyticus. And gram-negative bacteria examples are the E. coli, Proteus, Klebsiella, etc. Under the virus, we can see the examples are the immunodeficiency virus, hepatitis B and C virus, cytomegalovirus, fungi like Candida albicans, Aspergillus, then protozoa like Entamoeba histolytica, Plasmodia, etc. These are the various pathogens or disease-causing microorganisms. Then modes of transmission for the hospital-acquired infection are due to contact, airborne, oral route, or parenteral route. First, contact. How this hospital-acquired infection transmits through the contact. First one is through the hands or clothing. Hands of the staffs. The hand of the staff which are used, they may be the cause of the infection. The hands of the staffs which are not washed properly or which are not sanitized properly after touching one patient, and if they are touching another patient, then it may contact the disease. Then clothing. In the clothing there are also certain bacteria and virus which are which can stick to the patient's clothing if they are not washed properly. So like Staphylococcus aureus, Staphylococcus pyogenes, this may attach to the clothing, and if they are not washed properly and used in another patient, then this may cause the infection. Then inanimate objects. These are the objects like the improper disinfection of instruments like endoscope, bronchoscope, while doing the endoscopy. After doing the endoscopy, if the instrument is not washed properly, if the instrument is not sterilized properly, then the bacteria or virus may attach to the instruments also, and they may cause the infection. And next is the airborne. Through the airborne, like in droplets of respiratory infection transmitted by inhalation. If If the disease is transmissible through the droplet infection, and if the staff or the patients they are not using the masks properly, if then it might get transmitted from one patient to another. Then dust from bedding, floors, wound, exudate, skin. So if in short, if we can say if the patient surrounding is not kept properly, or if the patient surrounding is not kept in a clean manner, then this dust floor and the dust from floors and beddings and from the wound exudates. That means the dried particles which are fallen off from the wounds. This may also infect another patient. Then aerosols from the nebulizers, humidifier, and AC. This may also carry the infectious particles, and they may cause the infection from one patient to another. Third one is the oral route. In the oral route, from the hospital food may contain antibiotic-resistant bacteria, then colonize the intestine and can cause infections through the oral route. That means from ingesting or from eating the substance. Then the fourth one is the parenteral route. This parenteral route is transmitted through the injections or needles which are infected, which can go into our bloodstream, like disposable syringes and needles. If the disposable syringes and needles, they are one-time use only, so if they are used again and again, they might carry the infections. Certain infection may be transmitted by blood transfusion. From the blood transfusion also, certain disease or certain virus or bacteria may get transmitted. Tissue donation, HIV, contaminated blood products. So through the blood transfusion or through the injection of the various blood products, this HIV or hepatitis B virus may get transmitted. Now let's see what are the common nosocomial infections. The first one is a UTI. It is a urinary tract infection. 40% of cases of UTI falls under the hospital-acquired infections. Usually, it is associated with catheterization or instrumentation of urethra, bladder, or kidneys. UTI is mainly transmitted from the catheterization. While doing the catheterization, the staff or the person or the staff which is doing the catheterization might not follow the aseptic techniques. Due to that, the UTI may occur, or if that is not happening, or it may occur due to the not taking daily care of the catheterized patients. Okay, so the catheterized patient should be cared for every day. The catheter should be cleaned in the sterile technique every day. So if the staff is not doing that, then bacteria or viruses might enter the flora. Then due to the instrumentation, due to various diagnostic procedures, we are using various instruments inside our urethra or bladder or the kidneys. So while doing the instrumentation, if the instrument is not sterilized properly or washed properly, then the infection may also occur. Example are E. coli, Klebsiella, Proteus, Pseudomonas, etc. Next is the pneumonia. Pneumonia is a leading cause of mortality in patients suffering from. So pneumonia, here the lungs of the patient will get inflamed or infected. And it is mainly acquired during the aspiration in unconscious patient and pulmonary ventilation. So when the patient is in the unconscious state, we may do the aspiration of the fluid from the lungs of the patient. During that aspiration, if the instrument we are using or if the tube we are using is not sterilized properly or cleaned properly, then the patient may get transmitted. The patient may transmit the infection and suffer from pneumonia. Or in case of ventilation, if the patient is receiving the ventilation through the endotracheal tube, then if we are doing the suctioning in the unsterile technique, then the infection might also occur from that also. So we should always take care while taking care of the patient with ventilator and while suctioning. This is the most common cause and the most leading cause of mortality in the patients suffering from the hospital acquired infections. The examples of the bacteria are the Staphylococcus aureus, Enterobacter, Acinetobacter, etc. Next is the wound and skin sepsis. It is acquired after the surgical procedures where causative agents are introduced into the tissue during operations. So while doing the any surgery or surgical procedures, the causative agents, they may get introduced into the tissues inside the patient's body during the operations. It occurs mostly in the elderly patient and manifests within a week of surgery. It is also caused due to the non-surgical wounds like burns, bed sore. So while doing any surgical procedures, these causative agents will get transmitted into our bloodstream or inside our wounds during the operation, inside our tissues. Okay, then not only due to the operation, due to the non-surgical wounds like burns, if the patient is suffering from the 3rd degree burn or the skin is easily exposed, then in case of bed sore while in which the patient's skin is not intact and the wound is easily seen from the outside, then these causative agents will enter into this also. Next is the gastrointestinal infections as a result of food poisoning due to Salmonella or Shigella. This can also cause the diarrhea due to the E. coli. These are gastrointestinal infections. They are mainly caused due to the food poisoning. Next is the bacteremia and septicemia. If there is the presence of bacteria inside the bloodstream, this is known as the bacteremia. This is mainly caused by the infected IV cannula. When the IV cannula is not taken care of properly, this virus or bacteria may enter the bloodstream. Next is the tetanus. This is caused due to the inadequate attention to aseptic precautions during the surgery. So while doing the surgery, if they are not maintaining the aseptic technique, then this tetanus may also be caused. This may cause due to the use of contaminated dressing or improperly sterilized syringes. This may be from the dressings or syringe or due to the giving of injections or inadequate good care. If any inadequate care is given while doing any surgical procedure, then it is known as then it may cause the tetanus infection also. Then prevention of hospital-acquired infection. How we can prevent the hospital-acquired infection? Administration of antibiotic therapy to the carrier, staff, or source of patients to destroy the pathogenic agents. When the infection is there, then after the confirmation of the infections to any of the staff or the patients, then antibiotic therapy should be given immediately. Then proper sterilization and disinfection of inanimate objects. So the various instruments or any clothing, any material which is used by the patient should be sterilized properly. Disinfection of excreta and infected materials is necessary to control the exit point of infection. So the excreta or the urine particles or the mucus, any body fluids which may or may not be infected should be taken care of by disinfecting properly. Then transmission can be controlled by regular washing of hands, disinfection of equipments and change of clothes. So when the staff which are handling the patients, if they are washing their hands frequently, if they are sanitizing their hands frequently, then they might not be able to transmit the disease. So we should take care while washing of our hands, and we should also disinfect the instruments, equipments in a regular basis, and we should also change the clothes if it is soiled or on a day. Use of sterile dressings, surgical gloves, face masks further contribute in the control of nosocomial infections. So sterile dressings should be used, surgical gloves should be used while doing the sterile technique, and face masks should always be used. Then pre-operative disinfection of the patient's skin. This is very important. Before the doing the surgical procedure, disinfection of the patient's skin should be done in a proper way. Proper investigation of hospital in acquired infection and treatment of such cases. So we should do the investigations, proper investigation. We should keep the patient surrounding clean and disinfected at all times. So this, whether the staff is doing or not, it should be checked by the infection control team or the infection control committee. So by doing the regular check how the staffs are handling the patients, we may prevent the infection from one patient to the another. Hospital Infection Control Committee, they are the committee which is used to inspect the infection control inside the hospital. The members of the Hospital Infection Control Committee are the chief executive or the hospital administrator or medical superintendent. They should be the chairperson. Then one clinical microbiologist should be there. He or she should be the infection control officer. Then infection control nurse should be there. Infectious disease physician should be there. Chief of nursing services should be there. Then medical record officer should also be there. Representative from major clinical specialties. Additional representatives of other departments should also be present. Then what they will be doing, what the infection control committee will be doing. Let's see their functions. They are helpful in formulating and updating the policies on matters related to hospital infection. So they will update various policies and they will formulate the policies on related to the hospital infection. Like they will make the rules and regulations inside the hospital, and they will also regulate the list of activities which should be taken place in any procedure, or while doing any procedure, or after doing or before doing that procedure. They will form the policies inside the hospital. Then they will review and approve surveillance and infection prevention program, emergence of drug resistance. They will do the survey of the various infection control programs, and they will also do the prevention program, infection prevention program inside the hospital. We will see what all activities are undergoing inside the hospital, if they are prone to getting the infection or not. Then they will also do the infection prevention program. They will teach the various staffs in order to prevent the nosocomial infection, different antimicrobial agents. So they will see whether the antimicrobial agents are used properly at the right time or and at the right concentration or not. Proper sterilization and disinfection procedure. So they will also survey, they will also look over if the proper sterilization is taking place or not, and if the proper disinfection procedure is doing or not, to assess and promote improved practice at all levels of health facility. They will also see the practice of the various healthcare providers, if they are doing the care or not, including the physicians, including the nurses and other, then the housekeeping, sweepers and all. They will assess all of them if they are doing the proper infection control measures or not. And to obtain and manage critical bacteriological data and information, including the surveillance data. They will obtain and manage the information and data. They will note down or they will document all types of errors which are done while doing the infection control measures, and how far they have come. To ensure appropriate staff training, the training of the staff. They will also provide the development of policies for prevention and control of infection. They will monitor and evaluate the performance of the program. So after doing the program, they will see how the staff are practicing, or they will do a test in order to evaluate their performance, to recognize and investigate outbreak of infection in the hospital and community. So they will also investigate the outbreaks of any infection. So if there is any infection inside the ICU in the hospital, then they will recognize what type of infection is occurring, due to which type of procedure it is occurring. They will investigate the matter, and they will try to find out the solution. So these are the functions of the Hospital Infection Control Committee.